Quite often I think patients are involved in things, whether it's steering groups, patient groups, and not really sure how, whether they're there as an exercise to just say they're there, whether they have a real input. And I think even though I myself, haven't been through cancer, I think, through our organisation we've been able to pull together a lot of anecdotal evidence from the mums that we support to be able to make the case, to oncologists and other clinicians that attend, an event such as this and say, look, you need to listen to women. There's certain symptoms that you need to be, to be looking out for that, can otherwise be masked by a pregnancy and not be, almost fobbing women off to say, oh, you're pregnant, it's fine. There are genuine symptoms that can be hidden, by a pregnancy as it goes into full term and, and later on and even postnatally as well. But one of the other main things for us is about making sure that women have choice. So making sure that those oncologists are working with the midwifery teams, the midwifery are working with the obstetricians, and making sure that if there's any decisions that are placed in front of those mothers or mothers-to-be, that those decisions are based on clinical facts rather than somebody's perhaps lack of experience or just a general uncomfortability with dealing with the scenario of cancer and pregnancy coming together, because it is, it's something I don't think any of us are really that comfortable with, with wanting to talk about, and there's myths that we need to try and pick apart. Treatment being available, during certain stages of pregnancy. A lot of people sadly are told they can't be treated, and we know that isn't true. An event like this where you have one of the most senior researchers in this field, who has openly spoken about the fact that there are options available to women, and we need to be able to try and break down those myths, and we can only do that with an audience like you have here. I think to be able to reach the right people and sort of get them to, I think, spread a message to say, look, listen to women, they know their bodies, make sure that you don't treat the cancer but treat the patient and treat the family, that is behind them, because above anything else, from our perspective, a pregnant woman with cancer is still a pregnant woman first and foremost, and she needs to be treated as such, rather than suddenly becoming a cancer patient and then she loses, the enjoyment of that pregnancy. And there are, they're not huge groundbreaking things that can be done. There's little things that can be done during that process that can hand that woman back the control of that situation rather than having it pulled away from her. So, being able to speak to oncologists, to other clinicians, and also being able to work with other patient advocates who focus on specific cancers rather than where we're like covering, cancers per se across the board, being able to work with them to try and for them to add voice to us and us to add voice to them, and their patients in case they, are working with anybody who might come under the remit that we have as a charity in the UK and Ireland.